Namaskar. It's been a very productive budget session and much has been talked about the GST, but the session had very many other important bills being passed. Among them was the Mental Health Care Bill, the HIV/AIDS Prevention and Control Bill, as well as the Union Cabinet last month passed the National Health Policy. And to talk about all these important bills and the National Health Policy, we are very privileged to have with us the Union Health and Family Welfare Minister, Mr. J.P.Nadda. Thank you very much, sir, for being with us. We'll start with the National Health Policy. Now, it has a very ambitious aim of achieving universal, affordable health care for everyone. I mean, you're giving it as a right, a fundamental right for everybody. Is that what it is? Are we ready for this, sir?
Now, there is a difference between 2002 policy and 2017 policy. 2002 policy was disease-centric. It was focusing on how to eradicate and eliminate the disease. The changes which have taken place in the past 15 years was one, that the communicable diseases were earlier, which we were addressing. The additional factor came was the non-communicable diseases. And the fatality of non-communicable diseases was more than the communicable diseases. Okay. So this was one challenge. The another challenge was that the private sector had grown. So how to engage private sector to see to it that that can be also utilized for public sector or for public health care. So this was another aspect which was to be taken into consideration. And third was how to give affordable, equitable medicines and facilities to the people. So these three factors, as I said, that we were going for universal, comprehensive healthcare policy. Right. What we have started, that because for preventive and promotive, we early detection. Or for early detection, all children will be screened in the schools where defects, delays, deficiencies will be taken care and they will be addressed accordingly. We have started going for universal health screening. We have taken 100 districts where the training is done. Now we will have a universal health screening for diabetes, for hypertension, for cervix cancer, for breast cancer, for oral cancer. If we talk about affordable part, many actions have been taken. 700 medicines have been capped, brought under NLEM, National List of Essential Medicines. Stents, the prices of stents has been capped. We have started the outlets of Amrit, which is known as affordable medicine and reliable implant treatment. This is called Amrit. And here we are giving the costliest branded drugs with a reduction of rate to 90%, 60 to 90%. 83 outlets have been opened. Right. Approximately 19.25 lakh patients have been treated, have been given the medicines. Medicines worth 172 crores have been given, and these medicines have been given at the rate of 70 crores. So 102 crores the patients have saved because of this Amrit medicine. Sure. Then we have also started the Jan Aushadhi. In Jan Aushadhi, we are going for generic medicines. We have also started the program where free drugs and diagnostic facility will be given. Okay. In district hospitals, 600 drugs will be given free of cost. Some 50 tests will be done free of cost. In CHC level, some 300 medicines will be given free of cost. Some 25 tests will be done. In PHC level, this approximately 5 to 10 tests will be done, and some 30 to 40 medicines will be given free of cost. Right. So this is affordable.
So this is universal service across the country?
Across the country.
What about rural infrastructure? Everything's in place for all this?
For that, we are trying to see to it that the rural infrastructure is also taken care. We are giving special support to the states to see to it. We are taking care of the training part, we are taking care of the HR part, we are taking care of the infrastructure part, and the appliances part, and all these are being supported by Government of India. So this is how we are working. And as I said, that the new health policy is for the prevention and promotion. हम अब रोग से निरोग की ओर जा रहे हैं, तो उस निरोग की ओर जाने में प्रिवेंशन एंड प्रमोशन, इस पर हमारा विशेष ध्यान है.
When you give universal affordable health to people, it's okay for the people, but what about the doctors? They are under tremendous stress as well. Does the policy address some of the issues of the doctors?
We are going very fast on increasing the number of seats for medical institutions, for postgraduate seats, and we will see to it that the doctors, as required, will be there. Training will be there for them. Okay. And we are in coming times, we will be not shortage of doctors in coming times, because we are also proposing some changes in the medical education part, which is going to see to it that the speed and the scale of doctors can be increased.
Sometimes the doctors are under pressure and people sort of attack them, and if the things don't go according to their way. In that sense, what kind of protection is there for doctors?
See, this is a very serious matter. I have talked to the chief ministers and I have told them that you have to see to it that you provide a congenial environment where the doctors can work and see to it that they treat the patients. This also needs more communication skills. We are working on it also, and I think that is going to improve the situation. But security has to be provided. I have asked the states to see to it that security is given. And this is not a good trend which has developed. It should be condemned by all.
Also, there's rapid urbanization taking place, and also our population is aging, and a lot more elderly and senior citizens are coming into, let's say, need for healthcare. To what extent does the policy, cover them, and the senior citizen?
As I said, that our policy is comprehensive in nature, universal in nature. We are taking care of preventive, promotive, and in preventive, promotive, we are also taking for curative, and this we are doing for geriatric, for palliative, and for rehabilitative. Geriatric for the older people, palliative who are living with a disease, life-threatening disease, terminal patients, and rehabilitative, where we can rehabilitate them. All these things are taken into consideration in providing the health facilities, and we are going forward in that direction. Special attention is being given in all hospitals for geriatric patients. Special attention is being given for palliative patients, and special trainings have been also designed accordingly.
So the policy proposes free drugs, free diagnostic, free emergency care services in all public hospitals.
Yes. So free emergency services and free drugs and diagnostic facilities.
The policy also proposes raising public health expenditure to 2.5% of GDP. This is by 2025. So how is this spending going to be prioritized?
We have taken care. This year only, the budget, I'm happy to share with you, and thankful to Prime Minister Shri Narendra Modi ji and our Finance Minister Arun Jaitley ji. The budget enhancement has been 27.7%. Nearly 10,000 crores have been added. You see what happens when we go propose a project, when we propose the program like National Dialysis, Pradhan Mantri National Dialysis Program. Now in this National Dialysis Program, approximately 1 lakh patients plus have been taken care, and 12 lakh sessions have taken place. And all BPL patients have been given free of cost. So we have proposed 900 crores for that yearly. So as we are increasing the programs, the budget is also going to be increased in the phased manner. I would like to also share with you that budget had never been a problem. The problem was always the position of expenditure. The capacity to spend was very little, and that is what we are trying to enhance. We are supporting the states to see that they become capable for spending. Their spending capacity should improve. There are many states who are not able to spend their budget, and what we are trying to see to it that budget is reasonably and rightly utilized.
So the priority would be on primary, followed by secondary, tertiary healthcare, and then the policy aspires to provide district level. It goes like that.
And strike a balance between primary, secondary, and tertiary.
Now, you talked about preemptive and you talked about children being screened. How important is this? Because, if we prevent all the illnesses then and have healthy adolescents, healthy children, then obviously as they grow older, the problems don't come at all. Are schools involved, sir? How?
Yes, our schools are involved. We have got a program which is called as Rashtriya Kishore Swasthya Karyakram, where we see to it that the screening is done at the school level. So the schools are involved, the teachers are trained accordingly to see to it that where there are defects, where there are delays in the development of the child, what are the deficiencies, how it has to be addressed. So all these factors have been taken into consideration.
And you also have targets now for, we did talk about the first policy talking about reduction of diseases. There are targets to reduce incidence and all that. How is this going to be achieved with technology, sir? Also with Ayush?
The health policy has got a holistic approach. We are mainstreaming Ayush. And we have the health policy enunciates that we will have co-sharing of the institution with Ayush. We will have cross-references of Ayush, and we will see to it that integrated Department for Integrated Medical Care is developed, where all pathies together see to it that which pathy works better for which disease. So this we have started in Department for Integrated Medicine in All India Institute of Medical Sciences, New Delhi, and we are going to carry forward.
We're going to take a short break. After we return, we'll talk to the Health Minister about the HIV and AIDS Prevention and Control Bill that was passed by Parliament. Do stay with us.
किसान भाइयों गांठ बांध लो, बात बहुत है काम की, समृद्धि के पैगाम की। मिट्टी की तुम जांच कराओ, मुफ्त सॉइल हेल्थ कार्ड ले जाओ, कभी मुनासिब बीज लगाओ, सही किस्म की खाद ले आओ, जितनी जरूरी उतनी डालो, सही मात्रा खुद पहचानो। किसान भाइयों गांठ बांध लो,
आज ही मिट्टी की जांच कराएं, राज्य सरकार के कृषि अधिकारी से संपर्क करें और मुफ्त में सॉइल हेल्थ कार्ड पाएं। कृषि और किसान कल्याण मंत्रालय द्वारा किसान हित में जारी।
मैं ये नहीं पूछूंगा कि आप शौच के लिए कहाँ गए। मैं ये भी नहीं पूछूंगा कि अगर आप खुले में शौच के लिए गए तो क्या आपने अपने बच्चे की जान को खतरे में डाला? क्या आपके गांव की बच्चियों को खुले में शौच करते हुए किसी ने बुरी नजर से देखा? आप खुद समझदार हैं, सक्षम हैं। आप ये तो जानते ही होंगे कि हमारे देश में 70,000 से ज्यादा गांवों के लोगों ने खुले में शौच कर दिया है। गांव के बच्चे, महिला, पुरुष सब इस लक्ष्य में जुटे। निगरानी समितियां बनी जिन्होंने खुले में शौच कर रहे लोगों को समझाया, शौचालय बनाया, उनका इस्तेमाल करना सिखाया। क्या आपका गांव भी बनेगा खुले में शौच से मुक्त? आइए स्वच्छ भारत अभियान से जुड़िए। अब नहीं तो कब?
अरे सुबह सुबह इतनी जल्दी मचा रखी है। हाँ बाय पापा। आप में से कौन कौन विदेश में हायर स्टडीज के लिए लोन लेना चाहता है?
मैडम इंटरेस्ट कितना होगा?
जो भी अल्पसंख्यक स्टूडेंट विदेश में पोस्ट ग्रेजुएट डिप्लोमा, मास्टर्स, एमफिल, पीएचडी जैसी हायर स्टडीज के लिए लोन लेना चाहता है, उसके इंटरेस्ट पर सरकार सब्सिडी दे रही है। यानी आपके एजुकेशन लोन का इंटरेस्ट अब सरकार चुकाएगी।
मदद हमारी, मंजिल आपकी।
प्रधानमंत्री ग्राम सड़क योजना ने हम गाँव वालों के लिए तरक्की के रास्ते खोल दिए।
सड़क के गड्ढों की फोटो खींच रहे हो? कोई खास बात है क्या?
अरे काका, मेरे मोबाइल फोन में मेरी सड़क ऐप है, जिससे प्रधानमंत्री ग्राम सड़क से जुड़ी कोई भी जानकारी सरकार तक भेजी जा सकती है। सड़क से जुड़े सुझाव या शिकायत पर सरकार वाजिब कार्यवाही करती है।
प्रधानमंत्री ग्राम सड़क से जुड़ी कोई भी बात, मेरी सड़क एंड्रॉइड ऐप अब हर पल मेरे साथ।
Welcome back. So about the HIV bill. Now there are two aspects of the bill: ending social stigma and discrimination of people living with HIV and ensuring their right to privacy. How serious are these issues in this day and age? Because people have already come to accept, and treat people with HIV as part of society, or is that not happening?
No, that was happening. And that was because of the guidelines prepared by the health department. But it did not have the legal sanctity. It needed a legal sanctity. And it also needed a punitive action if this discrimination continues. And there were many aspects which were not taken into consideration. So that aspects have also been included. For example, when we say about discrimination, of course, the guidelines suggested that you can't discriminate, but there was no legal sanctity. Today, you have got a legal redressal system. Number two, as far as the stigmatization is concerned, now you cannot create an environment of hatred. If you do that, there will be criminal proceedings against them. So these are the things now getting the legal sanction, and the action is that civil proceedings and criminal proceedings will continue. So it's a very welcome step, but many things have been added also, like protecting the children's property, protecting the rights of the children. All these have been taken into consideration. So it is patient-centric bill which is now becoming an act. It is taking care of people living with HIV to live with dignity, and that is being provided by legal authority.
And any discrimination or unfair treatment against people living with HIV and their families, or employment, education,
in employment, in education, in holding any public office,
right,
and for livelihood, and you have to create a congenial environment, and you have to create a congenial environment in the also. You have to see to it. It is the responsibility of the institution or the organization to see that the people living with HIV are treated with dignity at the workplace, and also to see that if there are institutions like health institutions where the risk factor of getting this infection is more, the institution, the health facility has to undertake all types of precaution to see to it that nobody gets infected because of unknown reasons.
So it also makes antiretroviral treatment, it's a legal right for people with HIV/AIDS. And there are approximately 21 lakh people living.
This is a remarkable feature of the act. Previously, what we used to do, we used to give antiretroviral treatment only when the CD4 count of the blood reached 350 level. Then only the treatment used to start. We introduced that at the 500 CD count, you will be getting the antiretroviral treatment free of cost. We bring, and some 10 lakh patients were added. But now what we have done is test and treatment. The moment you are tested with HIV positive, one is tested with HIV positive, he has the right to get treatment free of cost. So this is one of the most remarkable feature where we are, and I'm launching this program next week, where test and treatment, where one is tested, and if he is found to be HIV positive, the treatment will start from that very day, free of cost.
It also talks about the management of risk reduction in vulnerable populations.
Yes.
Now, the vulnerable populations are sex workers, transgenders, MSMs, drug addicts. What approach is being taken, sir, to deal with this risk reduction? How does one go about it?
No, two things are there.
Okay.
Again, here also, now the state is bound to see to it that special efforts have to be taken so that there is a targeted intervention by the state governments in high-risk groups. And in the high-risk groups, with transgender or with MSM or with sex workers, we have to see to it through their participation, through their enlightenment, through working among them, see to it that all types of precautions are taken so that this is reduced and this is kept to the minimum. And this is binding on the state now, that we start programs, we keep on going with these programs so that this intervention at the targeted intervention groups is proactively done by the state government.
What system of redressal is there for the complaints? I mean, because a person can actually go through some sort of stigma or discrimination. Where do they go? How do they actually address the system?
There are two systems are there, as I said, for civil proceedings and for criminal proceedings. One is that the appointment of ombudsman. States have to appoint ombudsman according to the need of the cases and the number of complaints coming. Not only that, every institution, if he is having employees of 100, then he will have to keep one complaint officer. And if the health institution is there, then after 20 employees, one has to keep one complaint officer. And this will be mandatory, so that they take care about and see to it that the risk factor and all aspects related to the people living with HIV are redressed, addressed and taken care.
And one final question about this. It's also mandatory for all institutions to keep records. Is it established keeping records of people to adopt a data protection? They have to adopt data protection because they have records, but that has to be protected.
Protected, confidential. Absolutely. And for court proceedings also, they have to be kept confidential. And people...
The privacy aspect is very important.
Very important. And people who are in state custody, that is, if they are imprisoned, then also all types of facilities have to be provided by the state as far as treatment is concerned, counseling is concerned, taking care is concerned, all this, and their confidentiality has also to be kept.
So we're going to take another short break, and when we return, we'll talk to the Minister for Health and Family Welfare about the Mental Health Care Bill, a path-breaking bill that was passed by Parliament in the budget session. Stay with us.
ये लो और बताओ। बस। अरे ये क्या भैया जी, बस इतनी सी रासायनिक खाद? किसानी छोड़ रहे हो क्या?
किसानी नहीं, नादानी छोड़ रहे हैं। मिट्टी की जांच कराई है। अब तो लाला जी जितनी जरूरत है उतने ही उर्वरक खेत में डालेंगे। हाँ,
किसान भाई आज ही अपने जिले की नजदीकी भूमि परीक्षण प्रयोगशाला में मिट्टी की जांच जरूर करवाएं और मिट्टी में पोषक तत्व, नमी व पौधे के विकास को देखते हुए केवल जरूरत के अनुसार ही पोषक तत्व डालें। और हाँ, मिट्टी में गंधक, जस्ता, बोरोन जैसे सूक्ष्म पोषक तत्वों का पता लगाना भी न भूलें।
उर्वरक और जैविक खाद के सही उपयोग से भूमि का उपजाऊपन बनाए रखें, उत्पादकता बढ़ाएं, खर्चा घटाएं और बहुमूल्य विदेशी मुद्रा बचाने में भी सहयोग दें।
और हाँ, धीमी गति से नाइट्रोजन उपलब्ध कराने वाले उर्वरकों जैसे नीम लेपित यूरिया को प्राथमिकता दें और यूरिया का पत्तों पर छिड़काव करें।
अरे वाह, तू तो सचमुच समझदार हो गया रे।
अधिक जानकारी के लिए संपर्क करें जिला कृषि अधिकारी या किसान कॉल सेंटर।
मुझे मिला, मुझे मिला,
मुझे भी मिला
और मुझे भी।
अल्पसंख्यक कार्य मंत्रालय की इस योजना में छोटे कारोबारियों के लिए है टर्म लोन यानी मियादी कर्ज, जिसमें 10 लाख तक की मदद का प्रावधान है। एनजीओ से जुड़ी अल्पसंख्यक महिलाओं के लिए है माइक्रो फाइनेंस स्कीम यानी लघु वित्त योजना, जिसमें है 50,000 तक का कर्ज। इसके अलावा माइनॉरिटी कम्युनिटी के स्टूडेंट्स के लिए है एजुकेशन लोन स्कीम, जिसमें है प्रोफेशनल और टेक्निकल एजुकेशन के लिए बहुत ही कम ब्याज दरों पर लोन। तो आप भी NMDFC की कर्ज स्कीम से लाभ उठाएं।
हुनर को हौसला।
प्रधानमंत्री ग्राम सड़क योजना ने हम गांव वालों के लिए तरक्की के रास्ते खोल दिए।
सड़क के गड्ढों की फोटो खींच रहे हो? कोई खास बात है क्या?
अरे काका, मेरे मोबाइल फोन में मेरी सड़क ऐप है, जिससे प्रधानमंत्री ग्राम सड़क से जुड़ी कोई भी जानकारी सरकार तक भेजी जा सकती है। सड़क से जुड़े सुझाव या शिकायत पर सरकार वाजिब कार्यवाही करती है।
प्रधानमंत्री ग्राम सड़क से जुड़ी कोई भी बात, मेरी सड़क एंड्रॉइड ऐप अब हर पल मेरे साथ।
अरे सुन तो।
मुझे क्या सुनाना चाहते हो? जो सुनाओ मेरी सौतन को।
किसको?
अरे वही तुम्हारा मोबाइल फोन, जिससे सुबह शाम दिन रात चिपके रहते थे और कहते थे किसान कॉल सेंटर से बातें हो रही हैं।
अच्छा ये बात है।
हाँ, क्यों, क्या हुआ? अब बात नहीं होती क्या?
अब तो झट से बात हो जाती है।
ऐसा क्या?
हाँ, अब तो ज्यादा लाइनें और खास तकनीक के कारण खेती के माहिरों से तुरंत बात हो जाती है। और अगर कभी लाइन व्यस्त हो तो अपनी समस्या फोन पर रिकॉर्ड करा दो, वहाँ से फोन आ जाता है और समस्या की हल का मैसेज भी आ जाता है। ये देखो आ गया।
अरे वाह, इसका मतलब इंतजार की घड़ी अब खत्म।
हाँ।
तभी मैं सोचूं कि आजकल मुझ पर इतना प्यार क्यों आ रहा है।
कृषि संबंधी समस्याओं का अपनी भाषा में तुरंत हल पाने के लिए पूरे भारत में किसी भी फोन से हेल्पलाइन नंबर पर संपर्क करें। किसानों का दोस्त किसान कॉल सेंटर।
Welcome back. So let's turn to the mental health care bill. Now it decriminalizes the attempt to suicide, separating it from the Indian Penal Code. How does this one move actually change the way we look at people with mental health?
First of all, I will say and thank the members of the parliament who have supported this bill. This is a very progressive bill. And this bill is going to bring a sea change in mental health care. First of all, it makes health as a right, where the state is bound to take care of the health factor. Number two, even when a person is healthy and he is not suffering from mental disease, there is a provision that he can give advance directive and he can decide who is going to take care of him, what type of treatment he wants. This bill encourages not for institutional support, but to give treatment in community, so that we keep the patient in community. When we keep him in the institution, the chances of giving him mental treatment is less, in the sense that the environment has got a very important factor which plays. So we want to treat them in the community. That is being encouraged in this bill. You were talking about the factor of decriminalization. This is one of the very revolutionary steps which has been taken. It has been accepted that a person commits suicide under a great stress, and it is a mental illness. It is a mental disorder which has taken place. So it should not be looked as a criminal activity. It should be decriminalized, and it has been supported by all. This is a very, very revolutionary step which has been taken.
It also bans the use of electric shocks on children, yes. That shock therapy.
Not only that,
yes.
Not electroconvulsive treatment, yes. Right. Can be only given when the nominated representative gives the consent for the patient. Sure. The patient cannot be given electroconvulsive treatment without anesthesia. And the children in no circumstances can be given electroconvulsive treatment. They cannot be chained. None can be changed. So this is a very patient-centric, and it has got a human angle. It has got a human angle in this bill.
I can understand why the government wants to promote the community aspect, but what happens if, there are cases when people are abandoned, isn't it, in conditions of mental health? What happens then?
The state will take care, the state has to take care and see to it that, and especially the children. And what is important is that we are going to have a community counseling. This bill recognizes the caregivers. Okay. When we talk about recognizing the caregivers, that means people in community who serve the mental disorder people, they are recognized in the system, and they see to it that which patient needs to be sent to the institution or it has to be given a community support, and the medical part has to be taken care by the state after the passing of this bill.
How does the state also take care that, people who are suffering from mental illness are not taken advantage of? Even children taken advantage of by anybody in society?
This bill, again, enunciates about the punishment. And punishment in terms of those who do not fulfill the qualifications, and we also take care about being a proactive, see to it that anybody who is the patient is not being safeguarded properly are taken into account.
Now, you did mention that a person can give advance notice about how they want to be looked after. And this is important because a lot of people now are living under stress, and dementia is a problem, Alzheimer's becomes a problem at a later stage. But the point is, you know, I mean, who will follow these instructions? How does one actually enforce them? Because the person has, can't actually enforce them himself.
No, what the
these instructions, yes, it's like giving a will or something.
It's the provisions have been provided now.
Yes.
Now what we have to do is that, for example, if we find a person who is vulnerable to mental disorder, right. So all these provisions will be provided. This facility has been given to the family. They have to decide, and when he is stable mentally, he will give the advance directive, and he will also nominate his representative. Once his representative is nominated, he will take care of all the aspects during dementia or Alzheimer or other things which take place.
Is society ready? I mean, a society that's so fast-paced now. People don't have time for, to look after their own elders. What about looking after people who are mentally ill as well? Do you think that the society is actually this community approach is going to work, or we need institutions?
Institutions are needed for cases, vulnerable cases, or cases which need to be admitted. But their maximum mental disorder is to be treated in the community. We have to enlighten the community, number one, and we have to give them the legal sanctity so that no stigmatization, no discrimination, nothing which harms the mentally ill patient takes place. So when we give all the legal sanctity for all these provisions, it is going to the society is going to act accordingly.
Because there are 1 or 2% of our population which is apparently have acute forms of mental illness, so they will definitely need institutional help.
Yes,
right. And the other estimate says that 6 to 7% of the total population suffer from some form of mental illness.
Yes, they have to be treated in community.
That will have to be. Are we on the right track, sir? Because that number would amount to almost 100 million people.
Yes, we are very much on the right track. What we need is that in times to come, the caregivers have to be increased, the people who are going to support them have to be increased, and we have to take it in a positive direction.
Mr. J.P.Nadda, thank you very much for talking to us here on DD News.
Thank you.